Right now, that family, the Simpson family, has what they need for Rowan. Doesn't mean they don't have challenges, doesn't mean it won't be difficult in the years ahead. But they have the benefit of Medicaid right now. Medical assistance, as we call it in Pennsylvania. So Rowan now, because he has autism, has the benefit of those behavioral specialists and those assistants. In fact, there was a person with them the day that I met them to work with Rowan every day. So parents can work and have the peace of mind to know that they can go to work and they can raise their family with the benefit of the kind of health care that every child should have. So some might say, well, you know what? If the Republicans get their way on this bill, maybe the Medicaid provisions won't apply to Rowan. Maybe he'll be protected. Or maybe in Allegheny County, Amaya, maybe she'll be protected. Maybe it won't reach that far. Maybe when the Congressional Budget Office, and I'll read directly from that, page 17 of the report by the Congressional Budget Office analyzing the House bill, when it says, quote, Medicaid enrollment will be lower throughout the coming decade, culminating in 14 million fewer Medicaid enrollees by 2026, a reduction of 17% relative to the number under current law, unquote. That's what the Congressional Budget Office says about the impact of the House bill on Medicaid. 14 million people lose their Medicaid. So some might say, well, you know what? Let's assume for purposes of this argument that those two children that we just spoke about might be protected from those cuts. We don't know that, of course, and they can't guarantee that, because what they're doing when they go at these Medicaid provisions is taking away the guarantee that's been there for 50 years, okay? And over time, eliminating the Medicaid expansion. That's what we expect to happen. That's certainly what the House bill did. But let's assume for the sake of argument that they could come in here and make an ironclad guarantee that those two children, Rowan and Amaya, won't be affected. You know what? That's not good enough. That's not good enough, because there are a lot of other children who will be affected. Children who might have a disability. 60% of kids with disabilities are enrolled in Medicaid. We know that. We know that millions of other children who come from low-income families get the benefit of Medicaid. We know that a lot of seniors depend upon Medicaid to get into a nursing home. But no family that has a child who benefits from Medicaid, who has a disability, no family should have to worry for 15 minutes that what would happen in this chamber, because a small group of Republican senators are meeting in secret, and they're supposed to produce a bill that we're all supposed to consider in a short time frame. No product of that secret process should in any way give any parent that has a child with a disability any concern at all that benefit will be taken away. That's not who we are as a country. We're America. We take care of people that need those kinds of services, that kind of benefit. So if a child like Rowan, who's receiving the benefits of Medicaid today because of his disability, if a child like that is receiving those services today, we should guarantee that he will receive those benefits for as long as he needs those benefits, even if it goes the length and breadth of his life. We should guarantee that. Take it off the table so that family doesn't have to worry. That, I hope, would be the result of this process undertaken by a small group of Republican senators. And I've been waiting to hear that, waiting to hear whether or not they will guarantee that to that child, to give that family some peace of mind with all the challenges they have, even with Medicaid, even with the great support that they get. It's not easy. It's a very difficult life that many families lead with when they have a child with a disability. But we should do everything we can to make sure that if a child with a disability, just one category of people that benefit, any child with a disability who gets the benefit of Medicaid should have that protection for as long as they need it. And I'll be waiting to hear that from our colleagues when they finally emerge from this secretive process with a bill. So I hope that's what they're working on in their meetings, because we know that it affects a lot of children.